So my first chemo was in one of my peripheral veins. And I remember one of the drugs medics would understand, dacarbazine. That drug stung like hell, like it burnt all through. And they had taken all these measures. They ran it in a lot of fluid. They ran it really slow. I was having my chemo done in private sector. They were doing all the right things. Yeah. As in, you could just feel the drug coursing literally through your veins. Now my thought went back to the patients who we used to administer chemo to. And I remember saying, I'm very sorry. Because we used to do it in clinic.
Yeah.
So we never used to run the drug over 2 hours. I don't know, slowly. What these are people who are even coming for chemo from Meru and from such distant places. So the chemo was kind of rushed, and it was in an outpatient setting. And I remember saying, oh my goodness, is this what patients go through? It made me think about a lot of things. Obviously, how fortunate I was to be getting my chemo in a center where all the right things were being done. And being a patient, it changes you. And up until today, even my medical officers who I've had contact with and nurses, I tell them every doctor needs to be a patient, like a patient proper, not maternity. Not maternity. Maternity, yes, you're a patient, but that's a natural sort of process.
Yeah.
Every every medical person needs to be a proper patient. That cannula, having it put in when your veins are not clear and you're just there slapping and pricking again and another is pricking there, it's terrible. Personally, for me, I know being a patient changed the type of practice. My patients can bear witness. I'm very friendly. I'm very human. Yeah, I'm not that doctor who walks in and just says, "Wefanya hivi nini nini nini." Sometimes they even find it a little strange. Why is this doctor being so friendly? Why are they being so understanding? Why are they? But it's because I've been there. Yeah, I know it's you're at your most vulnerable. Everything is so scary. Yeah, and I think as a medic, it was even more scary.
Hi there and welcome back to Medical Conversations with Dr. Matthew Koech. Today we are really honored to have a special guest on our show. We have Dr. Hazel Mburu. Dr. Hazel Mburu is a doctor. She's a cardiologist in Eldoret Town. She's one of the first female cardiologists to practice in this side of the world. And I've known her for more than 25 years. She's one of those people who has the special honor of having been on both sides of the syringe. She's been a patient, but she's also been a doctor taking care of many patients. It's a story you want to watch. It's a story you want to listen to. And we welcome you this week to listen in.
Thank you so much, Matthew. Yeah, it's true. We've known each other a really long while. I usually tell people that we are age mates and we were classmates, and a lot of people can't believe it. My most clear memory of you is when we were traveling from Chiromo to KNH for practicals, and Matthew here used to hang on the bus.
Oh, the makanga
He was
of
the
the class.
he was the makanga of the bus. Yeah, and now, like how many years later, luckily ended up
25.
together in the same town and now working together. Yeah, growing and helping the people of Eldoret. So, as you've heard, my name is Dr. Hazel Mburu. Currently living in Eldoret, practicing as a cardiologist. Recently moved to the Transelgon specialist group. Born and raised in Nairobi. Eldoret happened. That had never been in the plan. So I was always a city girl. Went to primary school, high school, very Nairobi schools. I was in Moi Nairobi Girls.
Where did you go for primary school?
I was in St. George's Primary School. Then proceeded to Moi Nairobi Girls for my high school, and then ended up at the University of Nairobi for my degree in medicine. Again, did my internship in Meru, worked for a couple of months. I was posted to a little outstation hospital called Miadhene, and I knew I did not belong there, so I knew I needed to get back to school immediately. Fortunately, I got the opportunity to go back for my master's pretty soon. So I joined University of Nairobi for my master's in internal med. Yeah, then went through that and then joined cardiology practice, worked with one of the cardiologists in Nairobi, Dr. Martin Wanyoike, a great mentor from whom I credit a lot of my success in cardiology too. And then subsequently moved to Eldoret, completely unforeseen. Yeah. Followed, I moved to Eldoret for family purposes. My husband got transferred and I decided to move. So I came as I was, no plan. Again, another cardiology mentor held my hand, Dr. Barasa, took my hand, and I can say I have grown in cardiology in this town because of him, and he continues to mentor me.
Interesting. At what point did you start realizing, I want to be a doctor,
So my primary education, as I said, was in St. George's. Weirdly enough, I think by the age of 9, standard 3, I knew what I wanted to be. I wanted to be a doctor. My best friend at the time, her mom was a doctor. I didn't have much contact with her, but I don't know, I don't know if she directly inspired me, but I guess that was the one doctor I knew personally. She was a pediatrician. Yeah. And then, but my mom was a nurse, and my mom was a nurse until, she retired, had worked in KNH also as a pediatric nurse. So I guess there's always that medical background just hanging around me. But it's definitely something I wanted to do from the word go. Wow. Yeah, never changed my mind. Yeah. And as my big sister told me, I'm one of the people who are fortunate to actually be doing what they said when I grow up I want to be. Yeah.
Okay. And what drew you to medicine? What was the thing that made you want to be a doctor?
I think I've just always been a fixer. But my mother would contradict this because I used to break a lot of stuff. But I used to break so that I can put it together. Yeah, so who knows? It was what came before the breaking, the chicken or the egg, who knows? But yes, I think I'm a fixer. My younger sister was always my patient, and I thank her for that. She was very patient with me. I would always play the doctor. She would be my patient from a very young age. I honestly don't have like a life-changing story that I was very sick and I was saved by a doctor. I honestly don't have something that dramatic. But I think medicine is just something that appealed to me from a younger age, even before I understood what it actually was.
When you say fixer, to me that sounds like an engineer. Why not engineering then? Why medicine?
I don't know. I didn't know any engineers. But for me, it was just natural. I felt, honestly, I cannot tell you what drew me to medicine. I think it was just a natural, it just happened. It happened, and it was something. Then as I grew up, I loved to watch shows like ER. As we were growing up, we were not allowed to watch TV over weekdays. But an exception was made for ER. I think it used to come during the week. Yeah. And from there, I can say, it basically was downhill from there. Yeah.
So you were sold. Okay. Good. And your sister, it sounds like you credit your sister for being that early, model for you to practice on.
Yes, I credit. I don't know. Probably it was not voluntary. This was my younger sister. She's younger than me by 3 years. Was it voluntary? I don't know. But it was part of our playing. Yeah, I guess. So it was partially voluntary.
So what did you do? Examine or?
Yeah, I would even write prescriptions. Okay. I would write prescriptions, we'd give her dawa and say, this is, you examine her and tell her you have this problem and give her a written prescription. I don't know where I learned that. I don't even know what drugs we were writing. It would be interesting to come across one of those prescriptions.
Interesting. Wow. Okay. So then you finished primary school and you went to Nairobi Girls.
Yes.
How was your experience there? And what stands out? And what are some of the things that again confirmed your passion for medicine?
Okay. Proceeded to Nairobi Girls. So as I said, I think from the word go, I knew I wanted to do medicine. So from the get-go, I think I knew my cluster subjects, which is very unusual. Yeah. We picked our subjects in first form, which was unusual. It was a new system. Okay. But thankfully, at Nairobi Girls, biology, chemistry were compulsory. Obviously, maths was compulsory. Kiswahili and English were compulsory. So just by default, by the time we were clearing, you already had the correct cluster subjects. Nairobi Girls was a very interesting school. We actually used to call it, and this is no offense intended, this was actually the big pluses. I used to tell people it's like my high school was a summer camp. I hear about people talking about their lives, their high school lives, and it's just misery and bullying and I don't know what. In Nairobi Girls, there was a lot of freedom. Yes, we were not overloaded with preps. We did not go to preps at 6 in the morning. As long as you were in class, or rather, as long as you were in parade by 8:30 with the rest, whatever you did before that was really up to you. At 4 p.m., we finished our day. We had some preps in the evening after dinner, but it was not very strict. If anything, I remember we even used to read out our mail. So if Matthew is in changes or whichever high school, and he sent his all a letter, and we used to read it out loud and have quite a laugh. Preps were not strict. But what happened, I think, with that we were allowed home clothes, we were allowed a lot of junk. So what came out of all this, I think, was self-discipline. We learned how to self-study early. Yeah. Outside of your 8 to 4 in school, the rest was yours. Saturdays, we had like one prep, like between, I think, 10 to 11, and that was it. The rest of the weekend, it was up to you to do whatever you wanted, as long as you remained within the compound, obviously. So I think it taught us how to self-study, to self-manage our time in all this freedom. And I think that turned out to be a very useful skill in life. And that's one of the things I'm very proud of, being an alumni of Nairobi Girls. Yes, it felt like a summer camp, but it was building us for life, where we were going to go and we're not going to have somebody micromanaging every minute of your day. And I know a lot of alumni from Nairobi Girls, a lot of them in the sciences, a lot of them are doctors. And I think that self-management led to great characters being built.
Interesting.
I played soccer for a little bit. I wasn't very sporty. I think it was mainly for just to get out of school functions and things like that. Played basketball for a little bit. But another thing that, we excelled quite a bit, was a member of St. John's, the first aid club.
Yeah.
We actually excelled quite a bit. And I think, again, that's where the medicine thing again came in. So I knew about resuscitation and ABCs and BLS way before I stepped into medicine. We actually were Kenya 1 at some point.
Wow.
Yes. We topped the country in those competitions for St. John's. Yeah, so I think this fixing and medical thing was also nurtured a little bit there.
Wow.
Yeah.
Wow, so summer camp now. So by then now, you were sure now, by the time you're finishing high school, you're definitely locked in to medicine.
Absolutely.
And why Nairobi University? Why not Moi? I think at that time it was only Moi and Nairobi.
I actually didn't even know. Did I know about Moi University? I don't think I did. I knew there was University of Nairobi. And yeah, so
and
obviously others. It was that time, like you said, there were only those two. Moi University had never really been exposed to that part of the country. I didn't even consider it. I don't even know if I was aware that there was a med school. So University of Nairobi was the obvious choice because I would be close to home. Even if I didn't live at home, I would be close to home. So that is how I ended up in University of Nairobi. Yes.
Nice. Good. So you joined the University of Nairobi which year again?
2000 and... No. 2000. 2000. Yeah,
okay.
yeah, 2000.
Okay.
Yes.
How was med school for you?
Initially, it was a shocker. Yeah, I think you've come from... What index was I in high school? In primary school, I was a very high index number. I was top 10 index number. Then we came to high school, I think because of the balance between self-studying and a lot going on and a whole lot of other brighter students. I had a 3-digit index number. Yeah, but I think that didn't define... I think that's the thing. Things don't define us. Yeah. And eventually, didn't we all get into med school? Yes, we did. But obviously med school was shocking because the volume, the self-reading, as much as there was that thing in high school, this was a whole different ball game. The material was excessive. Now you're not living at home, you're probably living in a hostel, so you're taking care of your meals. Then you have all this freedom. You can choose either to party or to study or to balance the two. So it was quite overwhelming. But yeah, we survived. It was tough. Med school was tough.
Yeah.
But yeah, it was a great season. I have friends, some of my closest friends to date are the ones I made in med school.
Okay.
Yeah.
And especially for us, I think it was tough because we were the first, I think we were the first groups to start the 5-year system, which was a bit more squeezed. We used to do 44 weeks, and that was quite hectic.
Yes.
At what point did you start thinking about what to do beyond basic medical training? Because for most people, it's either medicine, surgery, obstetrics, pediatrics. For some of us, maybe you think about oncology, cardiology, nephrology. At what point did you start thinking about that?
So weirdly enough, again, I knew I wanted to do cardiology, or actually fancied cardiology from third year. It's an unusual choice. I don't know, but actually in third year we had one of our cardiology consultants was quite harsh, and actually a lot of people are put off from cardiology because of that. But for me, it was fascinating, and it seemed to just make a lot of sense. And I think our patients did well. And even up until today, I say cardiology patients, I think our prognosis most of the time is favorable. Yeah. So I fell in love with cardiology from basically third year. And internal med. I enjoyed internal med immensely. Let me take us back a little bit. During internship, I knew for a fact I had an amazing internship. Again, weirdly, one of the people who really enjoyed their internship. I did my internship in Meru. That time it was called District Hospital. Now I guess it's a county referral. It was an amazing experience. We worked a lot. There was a lot of surgical work. It's what we used to call Meru cuts, the famous cuts from unusually, assault, fights, things. But we did a lot of surgical work, I can tell you, for free. But I knew, for me already, you see, I have the background. I knew I probably didn't want to do surg, and I didn't want general surgery, and I didn't want to do obs. I think that was very clear. Pediatrics, I was really good with kids, but it was a bit traumatizing for me from the word go. I got too attached to children. I couldn't separate myself. So from me, I honestly knew I was not going to do pediatrics, but my mother begs to differ. My mother thought I was going to do peds. Her being a pediatric nurse, I think, had something to do with it. So for her, it was her dream to see me become a pediatrician. But honestly, it didn't work like that. Internal med was my thing. I like puzzles. Internal med, like some people who like to put things together like a jigsaw. It doesn't make sense in the first place. The answer doesn't come immediately. So it's like a detective. So for me, I think that's the type of a mind maybe that I have. And internal med was definitely an obvious choice. So cardiology, third year, we rotated. It made so much sense. Yeah, it just made sense. And yeah, subsequently in fifth year, I still enjoyed it. Internal med was a no-brainer for me, obviously. And then now, of course, in the back of your head, you're like, hey, this cardiology thing is not bad. Fifth year again, rotated. Yeah, it was still cardiology for me. Internal med, obviously, my thesis was cardiology based. So yeah, my journey in cardiology
began way back.
Yeah.
From way back. Okay, so you did your internship in Meru, enjoyed surgery, came back almost immediately for your master's. How did you find master's? Because for most of us, we really fear Nairobi for master's training. We feel that it might be tough, it might be too harsh. How was it for you?
So I was fortunate, as you say. I worked as an MO. So I finished my internship in Meru, worked as an MO basically for like 8 months. And then I knew staying out there in the machinani was not for me. I needed to get back to school as soon as possible. Fortunately, my dad welcomed it and was ready to support. So I went back almost immediately, literally 8 months from being an MO. MED, of course, we had had all the horror stories about doing your medicine in University of Nairobi. We had seen it, we had experienced it in the ward rounds. But that fear, I never really truly had that fear. Yeah, of course there was that apprehension. These guys are so harsh, they're so mean. But once we landed there, of course initially the first year was more of basic sciences, so we didn't have too much contact with the clinical guys. But once we got there, I don't know how to say this, but I'm able to, maybe it's a gift, I don't know, but I survived. I'm one of those people, I accept people for who they are. And I knew this person is mean, that's just who they are. And here we've just come to school. We've not come here to like each other. If you're used to making...
It's not personal.
Yeah, it's nothing personal. I things bounce off me fairly well. I'm like, it's nothing personal. You just teach me. Let me get my education. We get out of here. We don't have to like each other. But also I think I have a personality where people tend to be kind to me. So I honestly don't remember... It was tough, yes, but I think it was just a normal tough. And if you ask me, I never took it as like an individual attack on me as Hazel. I knew that everybody was having it rough. Everybody used to be toned down during the ward round, but you dust yourself off and you come back the next day. Yeah, not that it's the right thing. Obviously, the program it shouldn't have been like that. Yeah, but we survived, and hopefully we changed that culture. Yeah, maybe we are kinder now, hopefully, as consultants. It was a tough system, but it was not impossible. I think it was a matter of mindset. Yeah, knowing that I'm here for this. This person is just the way they are, but it's okay. I shall pass this. I will finish that rotation. Life will go on. Yeah.
So you were there for 3 years?
Yes. Yes.
And then you finished. Then what came next?
Again, cardiology came knocking. I think some things I don't know if they're written. I think it's destiny, by the way, yeah. So before I finished my final exam in MEd, I was approached with already a job. Somebody wanted me to join them. So a colleague, a former classmate or colleague, somebody who was ahead of me, had been in a cardiology practice at the Nairobi hospital with one of the consultants, Dr. Wanyoike. He was leaving for India for his further studies. So he was told, look for a young physician who can take your place. This is that guy who I hardly ever spoke to. I don't even know how I came to mind, honestly. But yeah, he came and he looked for me. I was like maybe 3 weeks to my final exam. And he looked for me and he took me to Dr. Wanyoike and he told me this is the one. And then I told them, guys, I have a final exam. And you know how casualty rate is very high MEd exams. And I remember Dr. Wanyoike told me, if you've been picked for this position, then you're capable. He didn't know me. That was the first time we met. Anyhow, so you can imagine the pressure when I went back. I'm like, I was self-sponsored by for MEd. So for sure, I didn't have a job waiting for me. And now here, one has been placed in front of me on a silver platter. And all I have to do is pass that exam. Talk about pressure. Yeah, but good pressure. And yeah, we thank God we sat the exam, we passed, and joined Dr. Wanyoike, where I stayed for how many years? For 6 years before now. Is it 6?
6 years?
Yeah.
Wow.
Before I now moved to Eldoret.
And how was it practicing with Dr. Wanyoike? Obviously, it seems like he made a big impression in what you've become. How was it?
It was interesting. It was very eye-opening. Initially, it was very, discouraging. So you've come in you're just a physician. Then now you're coming to work for this big short cardiologist. Even the clinic is named after him. So everybody comes to just see Dr. Wanyoike, Dr. Wanyoike, Dr. Wanyoike. So you are sitting in the office there and nobody wants to see you. Slowly, one patient who's in a hurry, can't wait for Dr. Wanyoike, says, let me just see the doctor that's there. Let me just see the doctor that's there. And slowly, but also he mentored, he encouraged, you can see my younger doctors, stuff. He really encouraged me through it. I mean, there was no that story for, and I just come here to read the newspaper. No, but also we were kept busy because in between, maybe you do the echoes, you do the stress test in between. So we were constantly learning. Then also doing ward rounds with him, just mainly accompanying him. But I think it was important to learn how things worked in private practice. Yeah, because obviously all my training was done in public hospitals. So that stint was very eye-opening in interactions in private practice, how things work differently, let's just say that, and how medicine differs, especially when resources are not such an issue. Because we trained for resource-limited medicine, truth be told. But this now was eye-opening. This was not resource-limited. People had resources. You had the tests. In fact, those drugs used to say, I'm not going to read about this because it's not available in hospital A. It was available in hospital B. So I think it was very eye-opening, and that thing for just learning how to manage patients in the private sector, that difference, it was quite eye-opening. A lot of networks up until today, I can say, came from my stint at Dr. Wanyweke's. Yeah.
So this was at the Nairobi hospital, the famous one?
This was at the Nairobi hospital.
Okay.
Yes.
So at this point now, you're just a general physician. You're not a cardiologist yet, but everything is gearing towards you being a cardiologist.
Yes.
So what happened next?
So I moved to Eldoret for family reasons. My husband got transferred to Eldoret. So we were like, okay. So we thought we could do the distance thing. At that point in time, our daughter was how old? She was 2 maybe. Yeah. But it became obvious it was tough raising her alone, like, and then dad would come over the weekend. I mean, he really was dedicated. Every weekend he was around, would leave very early on Monday morning, that sort of a thing. But since he was he's a very present father and has always been, that void was very clear in the middle of the week. And then obviously at my job was quite demanding. Our hours were long and that sort of a thing. Thankfully I had good help in terms of a very fantastic nanny and that sort of thing. I think also then we got our second born at some point. So support in terms of the nanny was fantastic, but that void left by my husband, father of our children, was quite loud. Yeah, so it became increasingly obvious that a choice needed to be made. Yeah, it's a choice I made. It was a tough one. We did some parenting class, by the way, at some point, and I can say that parenting class drove my decision to move, to keep the family together. It really drove that decision. It was not easy, but honestly, no regrets. Yeah, no regrets at all. Okay. And as fate would have it, I think sometimes you make a move, you don't even know what you're coming to. I didn't have a job in Eldoret. I was just literally following husband. But before I left, there's a friend who I knew. She used to work as she was working for a pharmaceutical company. She told me, oh, you're moving to Eldoret. Let me give you a number of some guy who maybe you could go speak to. Maybe he'll have something for you. So she gave me Dr. Baraza's number. I don't even think Dr. Baraza remembers this bit. Yeah. So I came to Eldoret. Before now we moved, I actually just came during the day. I saw him. We met at, it's called what? That's not sports club. Yeah, that at Eldoret Club. Yeah. When I called him after I got the number, I told him, hi, my name is so-and-so. I got your number from so-and-so. And I think I could be of help to you. That's how I introduced myself. So I told him, you come with your papers. We see what you have. So I came and I introduced myself. We met. I told him, this is where I'm at. This is what I have. This is where I've been. And he said, okay, you come over, settle, then we'll talk. So we moved, settled, I joined. Then I came and I told him, okay, now I'm settled, tell me. So he gave me a day in the clinic when he was not able to come to clinic. So I would sit in for him. Again, another season of sitting down and reading newspapers. But obviously, I had practice from previously. So all these patients come and they're like, oh, they've come to see Dr. Barasa. Then they're told, no, but there's another doctor. So slowly, again, you start seeing 1, 2, 3 patients. But like I said, destiny. Destiny is a very weird thing. So in 2019, I believe, so they were taking the first intake for cardiology fellowship, of which Dr. Baraza was the head of
program director.
Yeah, the program director. So there was an interview. So I told him, in fact, I want to come for this interview. He told me, we're looking mainly for guys from MOI, MTRH, capacity building. I remember that word. Then I told him, you know what, let me just come for the interview, just hear what people are asked. He said, okay, sour. So, yeah, so the interview came. We were 4 of us. 3, 2 were Moi, 1 was MTIRH. So I knew for a fact there's no way I was going to get in. But I just showed up all the same.
Yeah.
Showed up, did the interview, and then obviously I was not picked. So come 2020, I'd just lost my dad to COVID. I was at home for over a month. Well, I'm at home, Dr. Barasa calls me and asks me, have you applied? Obviously, the season that I was in, I was completely lost. I didn't know the position had even been advertised. So he called and he told me, it's been advertised. How about you apply? And I'm like, anyhow, long story short, ended up in the program. This program that initially was only for Moi and MTRH people. Again, destiny. Yeah.
Wow.
And that is how we ended up in the cardiology fellowship, and now practicing in this town.
Yeah. So, and yeah, I remember that back then when we were starting the cardiology fellowship program, and I think Joan was the first female cardiologist we'd ever trained in Moi, and you were the second. How did you find it, and how was it being in this male-dominated field of cardiology?
As you can see, my journey in cardiology did not start at MTRH. Yeah. It was always male-dominated from the word go. But as you have seen, my journey was always filled with these male mentors who carried us. So I think our male colleagues, supported us accordingly. But obviously, it's a difficult field in terms of time, the hours that you have to put in, training opportunities. But thankfully, with now more local fellowships, with Moi being the second, that made it easier for me. It made me going into cardiology training much easier. I didn't have to leave my family. So as much as it was male dominated, I think it's changing. And it's not a thing of male versus female. Those senior male colleagues are the same ones who have carried us up until today. Dr. Anyoke will still serve as a referee. He'll still mention my name in the right place. Dr. Barasa and a whole lot of other male colleagues. And I think people have become more accepting. The truth is, the future is female. Yeah. And doors are opening up. So yes, as much as it's been a male-dominated field, I never felt that somebody was literally purposely putting me down just because I was a female. If anything, I think the senior male colleagues actually lifted us, even when we didn't believe in ourselves. Yeah.
That's very encouraging. So you finished your fellowship, I believe, in exactly 2 years?
3. It's
3 years, yeah. And what came up next then for you?
So I joined a hospital almost immediately, and that's where I have been until now recently. Yeah, so obviously the name gets round, again saying colleagues who mention your name in the right places, you're in the right forums. I'm a very active member actually of Kenya Association of Physicians, Kenya Society of Cardiologists. So obviously your name gets mentioned in places. Somebody has a patient, especially like during the COVID time when people couldn't travel a lot. A lot of my former colleagues in Nairobi would refer their patients to me because now there was no back and forth traveling. So that also helped in starting to sort of build a name, build a practice, that sort of a thing. So that's what's going on. Yeah.
So you worked for Life Care?
Yes.
Briefly?
Yes, worked for them for quite a bit actually. Now recently transitioning out of and now joining the Transelgon specialist. And basically trying to build a practice in the town.
Okay.
Yeah.
Good. So obviously I think that has been, I think everything was set for you to become a cardiologist from early on, and everything seemed to line up for you. Any challenges along the way that you might have experienced? Anything?
Yeah, so actually challenges have been there. There's I went through something that probably I have not said this before in a public forum, but it's known to those who are close to me. So in 2016, I was diagnosed with Hodgkin's lymphoma. what started as just a cough, an irritating cough. And, it's you cough, but life is going on. You're going on about your normal business. Cough. You think, oh no, we have history of asthma and allergies in my family. So you're like, it's just one of those. You're changing inhalers. You're putting yourself on antibiotics. You're working. Life is going on. I've been a recreational runner for a while. So even then I was running, I was exercising. I mean, life was going on. I was losing weight, but we all thought, this weight loss is intentional, and we're all very happy about it. Cough. So one day, and every time I'd meet one of my senior mentors, who was a respiratory physician, and he told me, Hazel, you need to come and have a look at that. I'm like, yeah, I'm coming. I'm coming. Then one day, actually, literally, one of the nurses at the clinic where I was working at Dr. Adeke, she just told me, you know what, please just go see Dr. Mohinde, go have that thing checked. It's been a while. I was like, okay, fine, no biggie. So I walk up to his clinic and he told me, have you even had an x-ray done in all this? Then I told him no. He told me, okay, go have an x-ray done. So I dash to the x-ray department. They do for me the x-ray. They put it in the envelope. I don't even bother having a look at it. And I go and I give it to the doctor. And he puts it on the viewer box, and we were all taken aback. This huge, what I would say, cavitating lesion, a mass in my right middle lung. Yeah, and we're like, oh, well, must be TB. You've been exposed to patients, no biggie. Let's start anti-TBs. Obviously, that was very scary. Other people take anti-TBs. It's never you. But anyhow, we're like, it's okay. It's TB. But I went home crying that day. I can imagine. I was like, and even I remember his assistant helping me to the car with all these big boxes of drugs. Yeah. So I took my drugs. 2 weeks into taking the drugs, the cough was still there. And now the weight loss, I think, was also, now your antenna, your radar is up. So 2 weeks, I even got, my family got separated. I had to send, that time my daughter was, how old was she, 2? We sent her away to my mom's with the nanny, because we're like, now you have TB. I mean, but Tabi, he stuck with me. He's like, if I haven't caught this TB, it's unlikely I'm going to catch it in the next 1 month when you're on treatment. So he stuck by me. Child and nanny were shipped off to grandma's. I took the anti-TBs. 2 weeks in, I told Dr. Mohinde, no, I don't think this is TB. Then he told me, you're rushing ahead of yourself. Just finish the first 28 days. I told him that's fine. Continued taking the drugs. Day 28, I showed up and I told him. And then that time now we realized I had a lymph node swelling in my neck. Yeah, so I went and I showed up and I told him. But obviously we thought that was TB. Yeah, it causes lymph nodes, doesn't it? So walked up to his office 28 days later. I told him, you and me both know this is not TB. So let's find out what it is. Wow. So I was admitted. So they got the nodes out of my neck, bronchoscopy, everything was done. Obviously, it was a tough thing for my colleagues. I remember they literally played hide and seek. I think, first, of course, the diagnosis came out, but they needed they had to be cocksure about it. So this is a story I was told way later. My colleagues were playing hide and seek. Me, I'm in the ward. Sometimes you guys, you already have the lymph nodes. How about just let me go home to my child, then I'll come back if you guys need me. That time I hear the slides were already taken, the cassettes were taken to another pathologist to confirm and everything. All this is happening in the background, nobody's telling me. Then as I was in the ward, in my room, wherever in the hospital, I remember apparently my CT scan, no one was giving me any information. Yeah, everybody was just scatting around. But fortunately or unfortunately, somebody left my CT scan, in the room somewhere. So I opened it, and of course it spoke about the mass being either tuberculoma. The second, the differential diagnosis, of course, was lymphoma, and then the third one was lung carcinoma. So in my head, I said, I hope it's lymphoma, because I knew for a fact it was not TB. Yeah. So in my head, I know it's morbid, but in my head I go like, I really hope it's a lymphoma. Okay. Sure enough. Yeah, so they had to find a way to come and break it to me. But again, another thing, I don't know, there's a way we treat our colleagues, but I don't blame them. They are really trying to protect me from this scary diagnosis. Yeah. So I remember one night I was sent for CT scans. So they sent me for a CT scan of the neck, chest, abdomen, I think pelvis, I don't know. So in my head, I was like, for sure now, it's a cancer. They are staging me. Now, me in my head, I've already moved on from TB.
Yeah.
Now I know it's either CA lung or it's lymphoma.
lymphoma,
In
yeah.
my head, I'm praying it is lymphoma. So I go for my CT scans. Eventually, they came and they broke the news to me. Obviously, Dr. Anyoke was right there when the news was being broken, and Dr. Mohinde, the respiratory physicians, they're the guys who broke the news. And then they're like, do you want us to call a family conference? Or I told them, no, it's okay, I'll tell my family. Then they look at me and they're like, what's wrong with you? Anyhow, family conference was organized. Yeah, and it was broken to my family that this is what was going on. Then obviously, we knew what the course of treatment was. I was to start chemo. I was to have a PET scan. Unfortunately, that time in the country, there was none.
Yeah.
Yeah, so I had a friend, really close friend, who was living, like a sister, who was living in South Africa. So the two options were, the three I think were Egypt, India, or South Africa. So obviously South Africa was a more obvious choice. I had family there, basically. In fact, literally, she booked that procedure like ASAP as soon as she was informed. And also because I would have family with me as I went through it. So traveled to South Africa, got my first chemo through my IV access, and then went for my PET scan. And then now came back and then subsequently got a chemo pot put in, ready for the journey. Yeah, it was quite a journey, obviously. My daughter was young. She was 1 year, I think 3, 9, how many? She was 1 and something, barely 2 years. And in my head, I was like, surely, how... No, I'm not even going to be there to raise her to her 5th birthday. What's all this? And then you remember during MED training, we had an oncology rotation. So we used to give chemotherapy to patients in the oncology clinic on Mondays. And I remember they used to vomit a lot when they would see doxorubicin, the red drug. Yeah. The moment you mix that drug and put it up on the drip stand, patients would just start to vomit in anticipation. And I remember myself asking, I think I was having a conversation with God. And I'm like, Yani, me. I'm the one who's going to be given that drug that makes patients vomit even before they've taken the medication. Anyway, we knew that's what needed to be done. And I was like, if this is what needs to be done, so be it. So we started the journey. Yeah, it was an interesting journey.
How was doxorubicin?
Doxorubicin. My chemo journey was actually very interesting. I wasn't as sick as I thought I would be. Actually, surprisingly. I think I just vomited once after my first course. But subsequently, I learned a trick. Obviously, they'd give me the pre-meds before the chemo. And then now when you're being discharged from your day case, so your chemo, they'd give me Kytril. Yeah. Or one of those ondansetron, whatever, to take for a couple of days to help with the vomiting. So what I discovered is whatever they gave me last time, if I take it again just as I'm winding up my chemo, the vomiting wasn't as bad. So actually, the chemo was not as terrible as we thought. I actually put on weight while on chemo. I remember also because it reached a point I was like, I've done all the right things. I've always exercised, I've eaten right. I've never been a person of a lot of indulgences. Where the hell did this come from? And then everybody used to tell me, you eat well. This chemotherapy will make you reach a point you can't even be eating. I love food. I'm a foodie. I was like, thank you. Now I have a reason. So I really indulged in all the things I absolutely loved. I would go to Parklands, to Diamond Plaza, just to get a kg of chevdas, busu. And I ate those things unapologetically. I was like, I avoided these things and I still got unwell. So let us enjoy. So I literally put on weight while on my chemo. Towards the end, actually, the dose had to be adjusted. And then, so I was asking my oncologist that time, after my second chemo, I asked the guy, so when am I supposed to be so sick? I'm supposed to be kulemewa. The guy told me, you just continue with your life. Just if you feel unwell, it is okay. But don't wait to be sick. You just go on with your life, which is exactly what happened. So I would have chemo once every 2 weeks on a Friday. So that Friday I'd be off duty. I'd go to the chemo center and I'd be given my chemos. Weekend, I rest. Monday, back to work like nothing ever happened. So a lot of people didn't even know when I was going through my chemo journey. After a couple of them, obviously, my hair started to thin. It was already short. It started to thin. So one Sunday morning, actually that's when I started, like sometimes I'd shower and then there's hair in the tub. So that became a bit traumatizing for me. That's the one thing that actually reminded me that I was going through something. So one Sunday after a shower, got ready, I went to hubby. I told him, let's go to the barber's. He took me to the barber and I went bald, like bald square. So and I chose not to wear a wig. I chose not to do anything and just embrace my look. I remember Dr. Anyeke again, very concerned, telling me, you can wear a wig if you like. You can even wear a hat to work. It's okay. We'll be fine with that. I told him, no, I'm embracing my look as is. And I enjoyed it, by the way. Obviously, a lot of questions from patients, especially elderly females. A woman's hair is her crown. So I used to have a rough time with the elderly patients, females. They'll sit down and they'll lecture you. They'll tell you, Bana, you're a woman. What are you doing walking bald? The rest of me looked very well. So nobody could even have imagined what was going on in the background. I mean, I told them, don't worry. It's okay. It's a look and it's okay. Don't worry about it. Yeah. So we wore our bald look for the entire treatment. Yeah. And eventually finished the 6 months.
6 months of chemo.
Yes, of chemo, 12 cycles. Went back to...
Every 2 weeks.
Every 2 weeks. But funny enough, I worked through the entire time. There's no one time that I was too sick not to show up at work. Life continued. I continued raising my daughter. Life continued. Yeah, I think also it was maybe a mindset thing, but also the support, the social support was amazing. But I think mindset was everything. After I was told, don't wait to be sick, just do your thing. The day you feel unwell, that's okay. But don't just sit around there and start saying, I'm feeling unwell or that sort of a thing. So fortunately, the chemo wasn't as horrifying as we all thought it would be. So after 6 months, traveled again to South Africa. And had another PET scan. Disease completely gone.
Wow.
Yeah. So we've been in remission for 10 years now. Yeah.
Amazing.
Yeah.
Amazing. What was going through your mind that time when you were going through the chemo?
I remember my first chemo. I told you my first one was intravenous because they didn't want me to go travel for a PET scan with a fresh chemo pot. So my first chemo was in one of my peripheral veins. And I remember one of the drugs, medics would understand, dacarbazine. That drug stung like hell, like it burnt all through. And they had taken all these measures. They ran it in a lot of fluid. They ran it really slow. I was having my chemo done in private sector. They were doing all the right things. Yeah. And even then, every minute, as in you could just feel the drug coursing literally through your veins. And I now my thought went back to the patients who we used to administer chemo to. And I remember saying, I'm very sorry to anybody who, because we used to do it in clinic. So we never used to run the drug over 2 hours. I don't know, slowly. What these are people who are even coming for chemo from Meru and from such distant places. So the chemo was kind of rushed and it was in an outpatient setting. Yeah. And I remember saying, oh my goodness, is this what patients go through? And subsequently, I got some really bad irritation of that vein. For the longest, it was dark and you could literally follow the course through my arm. And it's really, it made me think about a lot of things. Obviously, how fortunate I was to be getting my chemo in a center where all the right things were being done. And being a patient, it changes you. And up until today, even my medical officers who I've had contact with and nurses, I tell them every doctor needs to be a patient, like a patient proper, not maternity. Maternity, yes, you're a patient, but that's a natural sort of process. every medical person needs to be a proper patient. That cannula, having it put in when your veins are not clear and you're just there slapping and pricking again and another is pricking there, it's terrible. I think it changes. Personally, for me, I know being a patient changed the type of practice. My patients can bear witness. I'm very friendly. I'm very human. Yeah, I'm not that doctor who walks in and just says, "Wefanya hivi nini nini nini." Sometimes they even find it a little strange. Why is this doctor being so friendly? Why are they being so understanding? Why are they? But it's because I've been there. Yeah, I know it's you're at your most vulnerable. Everything is so scary. Yeah, and I think as a medic, it was even more scary.
It made you better as a doctor.
I believe it has had a huge impact on the type of medicine that I practice. Because I've been there. I've been there.
Wow. Were you ever scared at some point about not recovering at all? Or?
At the beginning, yes. Again, I had a conversation with God. And I told him, honestly, how did you give me a child? Then I don't get to raise her to her 5th birthday. I don't know why I chose 5. Then in my head, I was like, no, I don't think that was the plan. And then from there, I dug in my heels and just did what needed to be done. Just took up the chemo, did everything that required to be done. Obviously, subsequently, there's always been that fear of recurrence of the disease. I think that always hangs somewhere in the back of your head. But fear of dying, I think after I had that conversation with God, I think we were done with it. I was like, you know what? I don't think that was the plan. Let's get this thing over and done with and let's raise these children. Miraculously, I conceived my second born 3 months post chemo.
After the completion of chemo?
Yes, and with an IUCD, with a coil in situ.
Wow.
Yeah. After they've told you, even after chemo, you can't get pregnant for another 3 years. God had other plans, I suppose. So I didn't know I was pregnant until 20 weeks down the line. Obviously, nobody was expecting it. I didn't have a period. That went away with the chemo. So you're not expecting. I was running. I'm putting on weight. I'm like, wow. Of course, I put on some weight during the chemo. So now even after chemo, I started running, exercising aggressively, eating right. Then the weight just stagnated. And you're like, hey, what's this? I even remember telling my colleagues, this is witchcraft. We used to laugh about it. Yeah, so then I started getting these pressure symptoms in my lower abdomen. And then I started panicking. I was like, wow, the lymphoma is back. And it was never in my pelvis, but I was like, who knows? Maybe it has come back and it has settled now lower down. So I went for an ultrasound. 20 weeks.
How was that experience?
How was my experience?
How was that experience like?
Shocking. I remember the radiologist laughing because she was the same one who did my staging scans. So she knew my story. She was a personal friend. Yeah, so it was shocking, extremely shocking. I mean, I'd done all the right things. I'd done my family planning. I'd not had, my periods had disappeared with chemo. I mean, there's absolutely no way I would have been pregnant. Obviously, there was no nausea, there was no vomiting, there was nothing. So I had no idea. In fact, at the time I was living with a friend of mine who was transitioning back into the country, a fellow doctor. So 2 whole doctors had no idea that there was a pregnancy happening. Yeah, so uneventful. The young man is turning 9.
Wow.
Soon.
Amazing.
Yeah.
Amazing. Wow, thanks, Doc. What are some of the things that you feel, are some of the lessons that you've learned and would want to pass on to the next generation of doctors?
As I said, I'm a strong believer, and I'm not wishing any ill on anyone, but I think every medical person needs to be a proper patient. It changes your perspective on a lot of things. There's a lot of things we take for granted as doctors. We explain to patients about, there'll be a side effect. But the truth is you've never been in those shoes. You've never experienced that side effect. So we just tell them what's in the books. But for me, what I think I would just really urge my colleagues is empathy. Yeah, and you never know. You could be the next patient. Yeah. So just treat everybody with kindness. Yes, there's knowledge. And I tell people, we all read books. Book knowledge is open to everybody. Guidelines are there for everybody to read and cram, if that's what. But what makes the difference in your practice is the way you make a person feel. How does that person leave that room after they've seen you? There are patients who come in with terrible diagnoses, as in maybe it's incurable, it's terminal, but there's a way you can show them empathy, there's a way you can speak with them and just let them have some hope. They may not get cured, but at least the rest of the journey will be humane, there'll be hope, that sort of a thing. Yeah, so I think the medicine is there. We can all study, but at the end of the day, what makes a difference is how we treat our patients. Remember that they're human. This is a mother, this is a father, yeah, and it could be you one day, honestly. It could be you.
Any of us.
Yeah,
that's absolutely true. So obviously now you're back to practice. You've been back to practice for many years. You're now venturing out to full private practice. Tell us about that. How is it going?
Well,
Elgon, you say.
It's interesting. It's a recent transition. Obviously, it's a little slow, but picking up. Yeah. So, but I've been in this season before, and I know it's part of growth. Yeah. It starts slowly, and consistency and just hanging in there will definitely pay off. Yeah. So I think for me, that's it. It's a different season. But I know it will be well eventually, yeah. But also enjoying the time. Now I have time on my hands. I think it was when I was working for the hospital, it was full time. I didn't have time to do stuff that I love. And
for yourself,
yeah, so I'm a recreational runner. I know I don't look like fun, but I will keep insisting. So now I have time to run and to build up, and hopefully hoping to run a full marathon sometime soon.
Haven't you run a marathon?
I haven't done a full one yet. So that is a work in progress for sure. Good. Yeah, so now at least I have time to do all that. I have time to spend with the kids. I have time to do homework. I have time to travel with the children. So I think it's a good season in its own. As we wait for the growth, it's a good season to also catch up with all these other things that make us who we are outside of medicine.
Definitely.
Yeah.
So Daktari, tell us, in your practice in cardiology, I'm sure many people will be interested to hear from you about the common challenges you face in cardiology practice. The traditional thinking has been, to get a heart problem, you have to be eating badly, you have to be smoking, high cholesterol, high body mass index, and stuff like that. But I think in my practice, we see younger people now and women who we traditionally don't think of having heart diseases showing up with these problems. What's your view on this, and what do you think needs to be done?
Yeah, as you've mentioned, initially we all knew about the traditional risk factors, which are still an issue. Yeah. But obviously the demographic now of your cardiac patient is changing. And also I believe it's because of our change, possibly lifestyle, environment, something. So, I mean, heart disease is no longer a disease of the elderly. It's no longer a disease just for males. I mean, younger people are now being affected. Women are also being affected. For females, I think it's slightly different also, of course, because they're different stages of our lives where cardiac disease is an issue. Around pregnancy, hypertension related with pregnancy, that sort of a thing. But also just cardiovascular disease in terms of coronary artery disease is becoming an issue for females also. And males too. But I think why for females it becomes a bit where we need to be a bit more careful is females, especially older females, do not present with the typical symptoms of a heart attack. We all know left-sided chest pain, crashing, worse when you walk. But for females, a lot of times the symptoms may not be those typical ones. So a female may be presenting with what looks like heartburn, indigestion. And a lot of times, pretty devastating diagnoses have been missed treating a female patient or a patient for indigestion, gas, that sort of a thing. So I think there needs to be more awareness, even not just I think in the cardiology circles it is well known, but also amongst our colleagues in our younger doctors, the medical officers, the interns. It's not only a heart attack is not only when somebody comes in with this typical chest pain. Sometimes it could be presenting less dramatically, but what helps is just taking a proper history and understanding the cardiovascular risk profile of that person. She's female, she's elder, okay, she's above 40, 50, she's diabetic, she's obese, that sort of a thing, and putting it together. Not there'll be heartburn, but also one of those heartburns could be masking something more serious. But generally, I think we need to just be more cautious and have our antenna up for the number, the figure for patients presenting with heart disease is getting lower. So we need to keep our radar up.
Okay. And what do you think about prevention? What do we need to do to prevent these things?
Currently, prevention is, we were taught prevention is better than cure. It sounds so cliche, but honestly, truly, and you will bear me witness, prevention is definitely better than cure. Cure is expensive, very expensive. And cure, sometimes it may be too late to reverse a lot of things. So prevention is everything. So for me, currently, my current passion is encouraging lifestyle modification. There's a lot going on. Everything now is digitalized. Everything is, you can do everything seated at your desk. You can run your meetings from the comfort of your house. You can run a whole enterprise just seated at your desk or in your house. We need to get out of that. As much as technology has brought up all those advancements that we can do all these things, we need to go back to our old ways. Sometimes my patients ask, "Oh, Dr. Ray, what should I eat?" I tell them, eat like your great-grandmother. Full stop. And I leave it at that.
Arrowroots.
Yeah. It's difficult. Arrowroots cost a bomb. I don't know if you've been to the market recently, but yeah. But I think let's fast movement. For me, that is now my mantra. Movement is medicine.
Walk.
Movement. Yeah. Whatever form. Yeah. If instead of, like you, I hope you walked from...
I walked from NKH, yeah.
Okay. Yeah, just movement. Movement is key. We keep talking about 10,000 steps. We are not just saying, try and cover 10,000 steps on a normal day. You may not be able to do it, especially like for a corporate person who just sits at a desk. It's very difficult. Take the stairs, walk, just movement of some sort. Keep moving. Instead of sending an email to your colleague in HR, how about you just walk there, and hopefully there's stairs to HR's office. Small
Walk
things.
to the market.
Walk to the market. Leave your car. Have a no car day. Yeah, just leave your car, and not leave your car and call an Uber, or just maybe walk halfway there or something. Thankfully, these days wearing sneakers is very fashionable. Everybody's wearing sneakers with everything. Yeah. So these days we are getting away with it. Yeah. Wear your sneakers, walk to wherever you're walking to, and then now come and change into your nice cute heels or whatever. So movement is everything. Movement is medicine. And I believe we're building a legacy. Yeah. Let's start now. Let's start young. Let's not wait for 30, 40 years. I'm going to join a gym. Now, when I'm looking back with the training I'm trying to get done to achieve a marathon or something, I'm looking back and thinking, I wish I knew these things in my 20s and 30s. Yeah. And it's easier to move in your 20s and 30s compared now at this our advanced age. Yeah. So movement is everything. Movement is medicine. And if you're intentional about it, you will achieve it. And then just making healthier food choices. Yeah, cut out the starches, the carbohydrates that are necessary, the highly processed foods. Yes, you can afford it, but at the end of the day, but it's becoming increasingly difficult to come across. And also, let's teach our kids to exercise. If I'm not exercising, I cannot expect my children to exercise. Yeah. So let's start building a generation that values movement, that values healthy eating. Yeah.
Okay. And the other thing also that we've been trying to promote on our channel is the issue of people going for checkups at least once a year. What do you think about that? Would that help also?
Yes, I absolutely would recommend that. We usually say maybe above the age of 40, but if you have the access to it, I think even 30, from 30 would be a great idea. Just have, and sometimes the checkup is something very simple. Have your blood pressure taken, have your blood sugar taken.
Checked,
If you have the opportunity,
Wait.
obviously, check your weight. And if you are in a position to get something like your cholesterol numbers measured, that's it, once a year. But weight and blood pressure and blood sugar, whenever you get an opportunity, especially if you have family history of these diseases, please check your sugars, because by the time diseases are presenting as now, obviously hypertension, obviously diabetes, that state has been there maybe for the last 5 to 10 years. You've been working slowly towards it. So if you can pick these things earlier, we can actually prevent or catch them early before they've caused any problems. Because like for me, people end up with a cardiologist because of the complications. So we had a good 10 years to catch this thing before you became a cardiology patient.
Now, as we wrap up, Doc, what do you think the future of cardiology looks like? What do you think things like AI, maybe robotics? I don't know whether robotics comes in your field, but what do you think about these newer things that are coming into medicine? And what's your opinion?
Everything is AI now. And obviously in medicine, AI has been there from way before. It's just that now we're giving it a name. As far back as you can remember, you've seen an ECG. The ECG is already reported. That was AI already. So AI has been in use and continues to be in use. It's just that now with advanced technology, we're being able to, like now you can do things like strain echoes. Strain echo is basically AI. Using your normal Apple Watch the Apple Watch is which you can even use to pick out an irregular rhythm. That is AI. Definitely AI is there. And it's the fact that it's making technology more available to people on a day-to-day basis to be able to pick out symptoms, to be able to pick out issues way before. So there's definitely a role for AI, and I think we can only get better in terms of medicine, in terms of technology, in terms of access to diagnostics and to care with AI.
So you think it's complementary to what we do?
Absolutely,
100%. Not a threat?
I don't think so. I personally don't feel under threat by AI, or maybe I'm being naive. But honestly, there's a touch. You can have, again, back to the ECG. There are times you'll see an ECG and it will tell somebody they're having a heart attack. And this is Dr. Matthew, who we were just sitting innocently with having a chat, and now suddenly he's having a heart attack. So you need a smart cardiologist to come and say, you know what, it's because of this slight elevation here, and then that sort of a thing. It's not a heart attack. So like in every field, I think AI is complementary, not necessarily that it is coming to replace us. We should embrace it.
Yeah, we haven't really talked about this fantastic husband.
This fantastic husband.
How did he handle it, the treatment? He's a Kalenjin man, right? How did he take it? Because, men don't take disease, like I said, as easily as women. And sometimes they pretend not to show it. But how was it for him? Maybe briefly, you don't have to say much.
I think possibly it was extremely scary for him. Being a non-medic, it must have been extremely scary. He's the kind of a person who doesn't even like hospitals, would avoid them altogether if he had to. And now here he's being thrown into a journey where hospitals will be part of your life very regularly. But he took it in his stride. He never wavered. Like when I tell you, when I was told to be on anti-TBs and I sent away my daughter and the nanny, he stood right there and he said, you know what, it's fine. We are going to do this. And he was, an amazing support system. He never showed his fear or his doubt, but I'm sure he had those questions. But he was there. He drove me to chemo it used to be in the morning, very early, would settle me down, make sure I have my breakfast. He was an absolute trooper, absolutely,
Thank you very much, everyone, for listening in today. We've had an awesome conversation with Dr. Hazel Mburu, a cardiologist and someone who's also been a patient in the system. And you've all had it, you know. For those of you who are facing difficult diagnosis, difficult diseases, you've been told some bad news, and you're going to start some challenging journey with treatment, you've had. It's about taking it on, accepting it, and just fighting through it. And Dr. Hazel did that. And then for the doctors, I think we've learned a lot also. Being on the other side of the syringe, we need to be empathetic, and we need to put ourselves in the shoes of patients. And I think it's been an interesting and awesome conversation. We urge all of you to like, to share, and subscribe to our channel. See you in the next one. Thank you, and bye-bye.